Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, esophageal perforation. How are you going to do operative repair of esophageal perforation? Now, for operative repair of esophageal perforation, the main principle of operative repair of esophageal perforation is to do a clear exposure of the perforation, followed by we should do a debridement of devitalized tissue should be done. Okay, first you will expose the perforation, then you will do debridement of all devitalized tissue, followed by that you should do primary closure, that is primary closure or primary mucosal repair is done. Okay, so here in primary closure you will do a primary mucosal repair is done, and this is performed by putting an interrupted and absorbable sutures. You will put an interrupted absorbable sutures are put for the primary repair of esophageal perforation. This intermittent absorbable sutures are put mainly to minimize the esophageal stricture formation in the patient. Muscular layer is also reapproximated with the help of interrupted or running sutures. With the help of interrupted or running sutures, we should even approximate the muscular layer also. Right. Depending upon the site of perforation, sometimes anti-reflux procedures may also be recommended in certain patients. Okay, anti-reflux procedures may also be recommended in certain patients depending upon the site of the perforation.
thank you and thank you for watching.